for putting this together. Last year we were here, and thank you for bringing us here again this year. I'm very grateful. My name is Fola Afelumo, and our organization was made after I lost my daughter, Antonia, who fought 4 years for ATTP. And the foundation was created on her honor to effect change by making sure others with TTP have better experience and quality of life. Inspired by my daughter, the AOFAC is just an acronym of her name, Antonia Onidamola Folakemi Afelumo Kusha. The foundation is a patient support and advocacy group raising awareness of TTP. It started in 2013, year anniversary of her death, and we have lived in three countries, United Kingdom, US, and in Nigeria. In US, we have lived in Washington, South Carolina, and Virginia. Our vision is a world where every person affected by TTPs receive timely and accurate diagnosis, compassionate care, and improved quality of life. We envision a society where TTP is widely understood by both medical practitioners and public, leading to a better treatment options and enhanced support for patient, family, and caregivers and their friends. Through our efforts, we aim to honor the memory of Antonia by making lasting impacts on TTP awareness, research, and patient well-being. And how are we supporting you? Over the last 10 years, we have strived to support you and our community in many ways. We represent patient perspective in the approval of medicine. Like Joe said, we work with NICE, we work with NHS England. Everything that was mentioned about the specialist center, we are part of it as well. It took a long time, like Joe said, 6 years of collaboration and reviewing and being the voice for us about, it's a voice for the patients. We collaborate with healthcare authorities and farmers, and we work with hospital care center as well, and care professionals. We provide direct support to patient caregivers and facilitate peer-to-peer support online. We work with institutions like NICE, where NICE is an equivalent of FDA. We also work, like Joe said, when we first started, I think there was 1 or 2 centers, and then we work in partnership with other group organizations to make it happen. It was an emotional period for me, I must say. So I put all my emotions through it to make sure there are some things that have to be changed. I'm stuck. Sorry. It's stuck. There we go. Thank you. One of our core and dedicated causes is to raise awareness of TTP. And we have been working to improve awareness of TTP among general public, practicing healthcare professional and clinicians. We continue to do this in many ways by canvassing. I'm sure Claire will remember we went to the parliament we went to the parliament, which to lobby and have discussion for TTP to effect an approval of a drug that is now helping TTP patients in England. We run different kind of awareness events, in-person, online seminars, which you guys, I'm sure so many people have joined because we open it up to everyone, wherever you are, everywhere you are in many countries. So everybody have access to joining. We also do sponsor works and balls. I'll talk about that later on. And we also do direct works with general practitioners, which I think you call physicians here. What we try to do is link out to them. They have something that is called time to line. So what we do is have access to that time to line. They do it once a month so that we can present TTP to them, because we all know some of them up to now still don't know about TTP. So we reach out to these kind of people. And also apart from that, we put flyers in strategic places where people can pick it up and read about it. Like I said, throughout this weekend, people are saying they didn't know about it. They didn't know about it. Some of the conditions, TTP has been confused with other conditions, such as ITP. We know ITP is different from ITTP. The symptoms might be the same, but the treatment is different, obviously. We also do like going to places, centers to do an awareness talk. The young lady you see here, we went to a university close to students, medical students, and she came to us to say that, we never know about it. We don't, something like this had not been taught in the university. I know it's a rare disease, but I think it's something that are needed to be, thought about, and we will speak about this later on. We want to do more. This is me passport. Joe was just talking about travel certificate and TTP card that you could take along with you. I know you have something similar but this is something you can use alongside of the existing resources that you might have, because it provides additional information such as critical care record, treatment preferences, vital statistics. We are collaborating with Cambridge Rare Disease to produce this. And they call it, this is main patient passport. The passport helps to facilitate difficult conversation by supporting a structured approach and a clear, effective way. This is particularly useful for speaking with new healthcare professional or in an emergency situation, which we all appreciate could be daunting and frustrating. It can be downloaded. We are still in the process of putting it together, and it will be mainly, they will do it for TTP patients, and it will be specific to what we want them to put in. And there's so many information that are related to you outside TTP that can be added. Many have other conditions outside TTP that could be added to the resources. And we are still, like I said, in the process. And if there's anything you think that we could add, it could be added, please speak to us and we could adjust it. As we all know, I'm from Africa, I'm from Nigeria, and we are very blessed and lucky in this Western country. And a lot of people are dying without even knowing of TTP. So what we're trying to do is transform, we want to transform TTP care in Africa. We have been working to partner with leading teaching hospitals, where TTP can be diagnosed and treated promptly. We're happy to say that Professor Scully has been involved in this from the beginning, and we'll be working tirelessly for this. And as part of the process, we are establishing a comprehensive registry to gather data, on TTP prevalence, clinical characteristics, and patient outcome across the region. We are collaborating with Nigeria Society of Hematology and collaboration with this leading organization to leverage local expertise in hematology. We have a vision, a visual vision in enhancing TTP awareness and education. We want to improve the recognition and management of TTP among the next generation of healthcare professionals and students. Our future efforts will focus on the following initiatives: targeted workshop and webinars, to have specialized workshop and webinars led by TTP experts. And this session will be aimed at junior doctor and nurses, paramedics and medical students to enhance their understanding of TTP in the real world setting. Like I said, we have students, medical students that doesn't know. We have doctors that are professional that doesn't know about TTP. And if you can grab them from the beginning when they are studying, and perhaps they could, they might want to specialize in the area. So we have more people joining Professor Marie Scully and Professor Sparrow to do the job. We will be partnering with schools and hospitals to integrate TTP case studies into assisted training, create a concise, high-impact education materials on TTP pathology and diagnostics. These resources we share with medical school, nursing program, and professional bodies. And we also, I think we talked about it with Professor Scully, to develop campaigns of informational materials to introduce TTP to medical nursing students by fostering early awareness. We aim to improve diagnosis rate and patient outcome. And we also want to do like a TTP-related CPD, support continuing professional development, to incorporate it into maybe something like GP or physicians who, learn about like a CPD courses. Right. So we have part of our initiative to raise awareness is awareness ball. We are having the next one is coming this December. It's only in UK only. We are planning, to extend it to US and Nigeria in the future. It's an event that's open to all. It is started with talks from TTP experts and professionals, where patients and caregivers, families have the opportunity to share their stories. So we have this event and people come in, look elaborate and flamboyant, people relax and people are able to talk about the condition, and families are there, professionals are there. Because they relax, they talk, and people get information that they wanted. And we will also be having a sponsorship works, which is coming on the 7th of September. And we have it in the United States. We'll be represented in South Carolina, Philadelphia, Delaware, California, Washington, Virginia, Florida, and New York. And for the first time, we'll also be having it in Jamaica. And on the same day, in the United Kingdom, we have two venues, where in London and in Essex to do the work, and also in Lagos, in Nigeria, and Ekiti State in Nigeria. What we do, we don't just do the work. After we've done the work, we go to High Street and give out information and talk to people, go to strategic places and give out information and talk to people. And that's what we do. So what we do at AOFAC Foundation is also to help you guys, is to be a voice for you, is to speak on your behalf, is to be there for you. We have a website and social media where we put all the information which you can use and join us and know what we're doing. And thank you again for listening, and thank you for having me.